Oral questions. The Leader of the Official Opposition.
Merci beaucoup, Monsieur le Président. Ça fait que la santé mentale, c'est quelque chose qu'on parle un petit peu cette semaine dans tout le débat au niveau de politique 713. C'est clair, un des impacts, c'est la santé mentale de nos élèves, et un autre impact, c'est la santé mentale de le public de Nouveau-Brunswick quand on a des débats aussi haineux et personnels qu'on a eus depuis les dernières semaines. Alors, moi, je suis concernée qu'on a un manque de professionnels dans cette profession à Nouveau-Brunswick. We are really running short on psychologists in our schools and in our province as a whole. So I wonder if the minister opposite could let us know what efforts are being done to ensure that we are growing the population, recruiting and retaining psychologists in New Brunswick. Thank you.
Minister of Education and Early Childhood Development.
Merci beaucoup aux membres, aux leaders de l'opposition officielle pour la question. C'est une question qui est vraiment importante. Il faut savoir que dans le secteur anglophone, on a 7,4 positions qui sont remplies. On a besoin d'un autre 33,3 pour avoir toute une équipe de psychologues. Au côté, dans le secteur francophone, c'est l'envers. On a 23 postes qui sont occupés, puis on doit embaucher un autre 2. Donc, on est toujours en train d'essayer d'embaucher les psychologues dans notre province. Merci.
Chef de l'Opposition.
Merci beaucoup, Monsieur le Président. Merci, Monsieur le ministre. C'est encourageant d'entendre que vous êtes en train de le chercher, mais c'est clair qu'il y a un gros manque. Alors, est-ce que vous pouvez clarifier c'est quoi que vous faites pour chercher et embaucher ces psychologues-là?
Minister of Education and Early Childhood Development.
Merci beaucoup aux leaders de l'opposition officielle pour la question. C'est une autre question vraiment pas importante. On tâche de faire le recrutement de partout qu'on pourrait. Un des problèmes qu'on a est que le salaire qu'on donne, je ne peux pas expliquer pourquoi il y a une si grande différence avec le côté francophone qui est presque rempli. On a toute une équipe presque de psychologues en comparaison avec le côté anglophone, une partie des défis à propos des endroits où on les avait besoin, puis une autre partie des défis est le salaire qu'ils peuvent gagner dans le secteur privé. Il faut avoir qu'ils ont un niveau d'éducation tellement haut selon leur organisation. Alors, c'est un grand défi pour nous autres. Donc, on continue et on va continuer de travailler sur ça. Merci.
Thank you, Minister. Chef de l'Opposition.
OK, mais peu à peu, on recevra d'autres informations. Alors, je suis encouragée que vous avez identifié que c'est le secteur anglophone et c'est un problème de salaire pour ce qu'on a assez de psychologues. Alors, est-ce qu'il y a une révision des salaires? Est-ce qu'il y a un travail qui se fait, une étude peut-être, pour déterminer si on peut changer des conditions au niveau de paiement ou d'autres choses pour que vous pouvez remplir le manque de main-d'œuvre de psychologues dans le système anglophone?
Minister of Health.
You know, Mr. Speaker, I hear the questions about recruitment and health human resource stresses and pressures, and that's not unique just to psychologists. And that's why we have a provincial-wide, a Canadian-wide, basic global-wide program, global strategy to recruit human health resources, which includes psychologists. And that has gone on various different ways, such as a campaign, website. We've created the Human Resource Branch within the Department of Health, which again has had very, very strong success in various aspects, and psychologists are part of that overall campaign. So, Mr. Speaker, we know, and the opposition should know, that human resource strategy and shortages have been an issue for a long, long time, and we've acted, and we're addressing, and we're getting results in those areas.
The Chef de l'Opposition officielle.
Thank you, Mr. Speaker, and appreciate the information from the Minister of Health. It's been a couple months, 6 weeks, since we got an update on the waiting list for primary care, and so it sounds like there's been lots of recruitment effort put in. Could you give us an update as to where the waiting list stands on Patient Connect for people trying to get primary care in New Brunswick?
Minister of Health.
Well, again, thank you very much, Mr. Speaker, and that's, again, a file that we continue to work on with many of our partners and stakeholders. And I know that from the success standpoint, we've talked about it here in the province, and going back to the recruitment that the member opposite talked about, there was great news that some of the medical students that have graduated here in the province of New Brunswick are going to stay and set up a family practice here. So, when other jurisdictions see their wait list rise, our wait list continues to drop. And we know that some of those physicians that have been recruited are going to be working with HealthLink to, again, take on some of those orphan patients, and we'll continue to work to make additional announcements on that as those clinics open up to take patients off that wait list. So there's good news in healthcare, Mr. Speaker, and we continue to do that work as we know the job's not done, and we'll continue to work hard to reduce that wait list and reduce the time on that list for people looking for primary care.
Acceptable opposition.
Thank you, Mr. Speaker. You mentioned the wait list is dropping. I'm hoping you can be more specific to tell us what is the wait list now, and I'll ask you to separate the two, because we understand there's a Patient Connect wait list, and then the folks get moved to HealthLink as a temporary solution, but don't have a permanent primary care home. So could you let us know how many are waiting on Patient Connect today, how many are on HealthLink?
Minister of Health.
Well, you know, Mr. Speaker, I've heard that we have the second lowest wait list here in the province of New Brunswick. In Canada, Mr. Speaker, and when we look at the number of people that have been taken off, even if it's temporary, even if it's to HealthLink, that is providing primary care, which was part of our overall plan. Part of our health care plan that we've been implementing in the 5 pillars, second pillar was access to primary care. So that's where you're seeing us increase the ability for pharmacists to provide services to the public that used to not be able to get into their family doctor. We've expanded the services and the ability for doctors, again, whether it's e-visit, whether it's walk-in clinics, whether it's, again, HealthLink and Health Connect. And again, the members opposite are looking for numbers. We've reduced that list by over 36%, and we're going to continue to do that.
Acceptable opposition.
Thank you, Mr. Speaker. Appreciate you acknowledging we're looking for numbers. So I take it that you'll go and check the updated numbers and come back and give us just a clear answer on that point. So I want to move forward in the fact that people do get moved onto HealthLink, but that is a temporary and a Band-Aid solution. It's not the ideal that New Brunswickers are looking for. They're looking for a primary care home, a patient-centered home where there are a team of professionals that will support their health. And that's not what HealthLink is. So there isn't continuity of care for those folks. They're in a Band-Aid situation. From what we understand, only about 1,000 of them have moved into permanent care environments. And so the wait list is still a combination of those two. But the minister and I had a chance to participate in a session around patient-centered homes and collaborative care a couple Fridays ago. And I believe the speech from the throne committed to the government advancing 4 of those. In this House a few weeks ago, the minister talked about a couple others. So can he let us know how many collaborative care clinics are currently in development?
Minister of Health.
Thank you very much. And yes, Mr. Speaker, we've worked with respect to collaborative clinics, and knowing that having a patient at a clinic that's basically owned by the clinic, or the clinical is responsible for those individuals, really helps access to primary care in a timely manner, and that is the key. And that's why we've gone forward with other initiatives that continue to improve the access to primary care here in the province of New Brunswick. I've mentioned them before, moving forward with pharmacists, where people can go in and get the ailment treated at pharmacy, which frees up about 80,000 spots in physicians' clinics or offices. So we have a number of various groups that we're talking to across the province that will either be doing family medicine practice or collaborative clinics, and we'll make those announcements as the time is appropriate for those.
Leader of the Official Opposition.
Merci, Monsieur le Président. Je suis vraiment intéressée de ces annonces, alors j'espère avoir une invitation de participer ou entendre. J'aimerais comprendre le processus parce que les gens de Bathurst, Esnapizziquet, Saint-Isidore et spécifiquement les gens alentour de Allardville où il n'y en a pas de clinique, il n'y en a pas de médecins aux soins primaires ou des infirmières praticiennes, ils sont intéressés de développer une clinique comme ça. Alors j'aimerais savoir pour une communauté qui se trouve loin de services de santé, quel est le processus qu'il peut suivre pour essayer de commencer de créer une équipe collaborative de soins dans quelque part comme Allardville?
Minister of Health.
Well, thank you very much, Mr. Speaker. One of the reasons that we have incentives for doctors to set up practice in rural parts of the province of New Brunswick, up to $100,000 to set up in rural parts of the province. That's the initiative. That's an idea going forward. And we've actually done more than that, Mr. Speaker. We had a great announcement in Rothsay about scholarships that we are giving to medical students for a return of service. And Mr. Speaker, that was very, very well received by the students in attendance and the folks there. So if there's individuals or groups of doctors that are interested in setting up care, again, it's a teamwork with various stakeholders, the RHA, the Family College of Physicians, and the Department of Health. So if the individuals or doctors are concerned or looking for that, they should reach out to the RHA. And as we talked about the bill yesterday, we want to make sure those agreements exist.
Thank you, Minister.